February, of course, is American Heart Month, and today is Wear Red Day to raise awareness. Joining us now is Dr. James Peacock, a cardiologist with White Plains Hospital, wearing a red tie, supporting the cause. Thank you so much for being with us this morning, Doctor.
Lisa, thank you for having me.
All right, in general, you live and work in Westchester. Talk a little bit about how the care has evolved here in the county. We don't have to go down to New York City anymore to get proper care, right?
Oh, so important. I am a resident of Westchester County for the last 8 years, and the complexity and the ability for the hospitals in Westchester County to be able to take care comprehensively of cardiac care is really growing. So I'm proud to be a member of White Plains Hospital, where we offer comprehensive cardiac care. In 2018, we started an electrophysiology program. In 2021, we started our cardiac surgery program. And it truly is you don't need to go down into the city to get excellent world-class cardiac care here anymore.
So a lot of great resources here locally because, of course, heart disease is the leading cause of death in the U.S. So who is most affected by this?
It's so true, Lisa. Heart disease is the #1 cause of death in men, the #1 cause of death in women, and the #1 cause of death in most ethnic groups. I mean, the statistics are staggering. One person dies of heart disease every 34 seconds. So February is American Heart Month. It is a time to reinvigorate our focus in heart health. As you were saying, I'm wearing the red tie, you're wearing the red dress. It is a time for us to refocus our energy on concentrating on our heart health.
Yeah, let's quickly talk about the warning signs. Do they differ for men and women?
They can. The warning signs of cardiac disease can vary depending on the type of cardiac disease. So if you think about heart disease as a pump, there are a number of things that can go wrong. The most common is called coronary artery disease, where the arteries that feed the heart get clogged up and ultimately cause a heart attack. So the most common symptoms that you hear are chest pain, kind of chest tightness, and shortness of breath, but not everyone gets those type of symptoms. Particularly women will have what we call atypical symptoms, such as nausea, upset stomach, and more lightheadedness. And 1 in 5 people will have symptoms that they don't recognize as heart attack, and will ultimately come out the other end having what we call a silent heart attack that was untreated.
Yeah, and quickly before we go, you do want to teach us some very important life-saving techniques quickly that can make all the difference if something is going wrong. Can you show us that really quickly before we let you go?
Yes, absolutely. So hands-only CPR. This is something everyone should know. You saw this happen with Damar Hamlin, the Buffalo Bills safety. If you see someone down on the ground, tap them on the shoulder, make sure they're feeling okay. If they're not responding, #1, call 911, get help. And then start hands-only CPR. Left hand on the chest or one hand on the chest, interlock your hands, and then pump down 100 beats per minute, 2 inches into the chest. That's all you need to do. If you need help with 100 beats per minute, use the song Staying Alive. So that beat is ha, 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 staying alive. That's 100 beats a minute. You can save a life.
Great information there, Dr. Peacock from White Plains Hospital. We appreciate your time and you showing us that life-saving technique. For more tips and resources on how to improve your heart health, you can head to our website, news12.com. That information also available by downloading our free News 12 app.